Hi, today I will discuss improving the health of Nebraska by expanding the Medicaid program through Initiative 427 and what that means for the health of the state of Nebraska. Medicaid was originally designed to provide health care coverage to the elderly, disabled, children in low income families, and low income pregnant women. This left out a significant part of the population who were low income adults that didn't have commercial insurance, but were also denied Medicaid because they didn't fit into one of those groups I just mentioned. In 2010, coverage was expanded by Congress to include this group, but 2 years later, the U.S. Supreme Court ruled that requiring states to expand Medicaid was unconstitutional. They left it up to the states themselves whether to adopt the Medicaid expansion or not. By 2018, 33 states and the District of Columbia had adopted the expansion, meaning 17 had not yet expanded. This is a map of the United States showing the status of expansion decisions as of last year, 2018. The dark blue are states that have adopted the expansion, the orange have not, and the light blue in 2018 were considering expansion. You can see that in 2018, Nebraska was one of the states considering. Several bills for Medicaid expansion were proposed, but none enacted. This led to the beginning of Initiative 427. Ballot initiative petition placed 427 on the November 6, 2018 ballot. If approved, it would require Nebraska officials to apply to the federal government for Medicaid expansion, as well as develop a plan for what the expansion would mean for the state, who would be eligible, and what kind of benefits would be provided. So why is it important that Initiative 427 is approved, and what would it provide for Nebraska? Well, it would provide health care coverage for adults living 138% of the federal poverty line because they are denied Medicaid and cannot obtain the commercial insurance. An individual living under that line makes less than $17,000 a year, or a family of 4 makes less than $35,000 a year. The federal government would assume 90% of the costs associated with the expansion, bringing tax dollars back to Nebraska. This 90% of cost would be about $500 to $600 million annually brought back to the state. Then state funds would provide the other 10%. There are numerous health and economic benefits of Medicaid expansion that have been proven by the 34 states that have expanded before Nebraska. With health care coverage, people are able to get the care that they need. They have access to care, and that leads to an increase in diagnosis of disease and in consistent care for people with chronic conditions such as diabetes. This results in lower numbers of emergency room visits and shortened hospitalization stays. The states that have expanded have shown an increased cancer diagnosis rate, especially in early stage cancer, leading to improved outcomes, increased heart transplant listing rates for African American patients, utilization of smoking cessation medications, and better access to mental health and behavioral health treatment. In Ohio, for instance, they saw an increase in prescriptions that treat opioid use disorder and the medications that help in an overdose situation. They also showed improvements in disparities by race, income, education, and employment status. They also saw improvements in measures of self-reported health. So not only were people able to access better health coverage, but they also reported that their health was better. Not only is Medicaid expansion important for the health of individuals, but also their financial security. Ohio's Medicaid expansion showed that the percentage of enrollees with medical debt fell in half. They had improved credit scores, reduced bankruptcy filing, and the enrollees who were unemployed said looking for work was easier. There are several economic benefits that states that expanded Medicaid showed. One example is in Montana, where the state was dumping a lot of money into substance use disorder services, but when federal dollars kicked in to expand their Medicaid program, that replaced the state dollars that were being used to fund the substance use disorder services. There's also a lot of economic benefits with a decline in uninsured emergency room visits. Instead, patients are seeing their primary care provider for routine needs. They saw reductions in hospital closures, especially in rural areas, and job growth. Colorado supported 31,000 additional jobs since expanding, and Kentucky created over 40,000. So, who needs health insurance in Nebraska? This list here of numbers, the top line you can see is the total number of Nebraska residents, and the bottom shows the number of residents that would qualify for the Medicaid expansion program. It's the uninsured Nebraska residents living below 138% FPL. This list here are some of the groups or supporters of Initiative 427. They worked in Nebraska to get people to the polls to vote in approval of the initiative to expand Medicaid. The good news is that on November 6, 2018, Initiative 427 passed and it was approved in Nebraska. Since November, the state has been coming up with a plan of how they'll use the federal funds to expand Medicaid. The deadline was April 1st, 2019, and that is when the plan came out. The title is Heritage Health Adult Program, or HHAP, and it has two types of coverage. One is basic coverage that is similar to commercial insurance market coverage, and it was modeled after the Blue Cross Blue Shield small group insurance plan. Prime coverage is basic coverage, but it also includes dental and vision, plus over-the-counter medications. This coverage also has some requirements, where everyone that is living below 138% can get basic. There's some different things you have to do in order to get the additional things with Prime. Members must apply for other forms of Medicaid or commercial insurance if they are eligible before applying for HHAP. And the proposed start date is no later than October 1st, 2020 for basic coverage to begin. Like I mentioned, Prime coverage has some additional requirements. Those include avoiding no-shows at your primary care provider, attending a yearly checkup or annual visit, and be employed or complete monthly volunteer hours or be enrolled in some sort of classes, whether it's at a college or a trade school. Some recommendations that we had involve focus groups prior to launching the expansion in order to better understand the population in need and to allow for better coordination. Having these focus groups would allow us to see the best way to get people to have access to the care they need and know exactly what kind of care would be best for them. The other recommendation is that perhaps the requirements for Prime coverage may be too difficult to monitor or too complex to have continuous audits of whether people are keeping their annual checkups at the doctor or no-showing visits. Enrollees may flip between plans. If they lose a job or they don't attend enough doctor's appointments, they may flip between Prime and Basic and become frustrated with their health care plan and not access care at all. There's a great public health impact of expanding Medicaid. Not only does it improve the health of adults by improvements in disparities and their use of preventative care, mental health services, and primary care, it's also cost effective for both individuals and the state. And the wellness requirements as part of the Prime program can provide more workforce and community engagement, socialization, and quality of life improvement. Also, with patients showing more doctor's appointments, there may be improved provider feedback. Initiative 427 and expanding Medicaid in Nebraska is extremely important for the health of individuals. Providing uninsured Nebraskans with access to medical care will save lives and decrease the financial burden of health care, improving the health of the entire state. Thank you.